May adlaw na tong tanan. What if you can recover quicker from your hip replacement posterior approach? Would you want to know it? Well, I got you. In this video, we are going to do those exercises to get you back on your feet faster. Hi, I'm Nathan. I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. After you had your hip replacement posterior approach, your doctor will give you precautions that you need to observe for 6 weeks. And then your doctor will refer you to a therapist to help you remember those precautions and to help you do the exercises so that you can heal faster and avoid dislocation. The therapist will also help you do the exercises that will help you get stronger faster, that will help you reduce the pain, and to get you back to your daily activities. For the first few exercises, we are going to do them on your bed. And please observe your hip precautions. If you want to remember and know your hip precautions, please click on this video right here. Okay, so the first exercise is going to be the ankle pumping. So just put a pillow under your leg and let your ankle hang. All right? This is in preparation for the other exercises. We're going to warm up that leg and get that blood flowing. All right? So you're just going to do the ankle pumping a few seconds or a few reps. All right? So just do that a few times. And then you move on to the first exercise, which is the quad squeeze. All right? For the quad squeeze, you're just going to move that pillow up higher here under your knee. All right? Let me move this pillow so you can see better. So just under your knee, slightly bend your leg from the knee, and you're going to push that pillow down using the back of your knee. You're going to feel the squeeze here on your quad muscles, all right? And then hold it for a few seconds, maybe 10 seconds, 10 to 12 seconds, and then release, all right? Push it down, 10 to 12 seconds, and then release, all right? Let's do that one more time with counting this time, all right? Push down, squeeze the quad, and 2, 3, 4, 5, 6, 7, 8, 9, 10, release. And that is your quad squeeze. Third exercise, just move that pillow again down under your foot. Don't let your ankle hang this time, all right? This is your hamstring squeeze. You're just going to push that pillow downwards using the heel of the foot of the leg that you had your hip replacement. Push it down a few seconds, 10 to 12 seconds again, and then release. You will feel the squeeze here in the back of your leg, your hamstrings, okay? So we're going to do the hamstring squeezes right here. Hold and then release, okay? Make sure that your toes are not pointing inwards. That will internally rotate your leg and you will be at risk of hip dislocation, okay? So you're going to again push that pillow under using the heel of your foot for a few seconds, 10 to 12 seconds. And let's do that one more time with counting. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that is your hamstring squeeze. Next exercise is going to be the butt squeeze or your bridging. So when you do your bridge, just bend your knee slightly like that, and put your hands here at the side for additional support. Bring your hip up and then squeeze your butt cheeks together for about 10 seconds and back down, all right? Let's do that one more time. And then down. So this is pelvic bridging or your gluteal squeeze, all right? One more time, about 10 seconds. Alright, so that is your bridging or your gluteal squeeze. The fifth exercise is kicking to the side. So make sure you're not going to turn that toe or that leg inwards, okay? Otherwise, you will dislocate that hip. So you're just going to kick to the side 10 to 12 times. But let's just do 10, okay? And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, let's do the other side too. Okay, just remember, take those small steps when you are going to turn. Okay, remember your hip precautions. Okay, we're going to do the other side too to train the leg that you had your hip replacement with the weight bearing. Okay, so let's do the good leg. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that is side kicking. The sixth exercise is leg swinging. So we're going to stand on your good leg. All right, and then you just swing that leg with the hip replacement back and forth. Not too much, okay? So just like this. Let's do that 10 times, all right? And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And again, we're going to do the good leg too. All right, again, turn, take those steps to avoid hip dislocation. All right, we're going to train the weight bearing of the leg that you had your hip replacement. Swing the good leg. All right, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that is leg swinging. And then finally, we are going to do the ankle rocking. This is to train your ankles to properly move when you are walking. All right, so we're going to just rock our ankles back and forth. Okay, so heels up and then toes up. Heels up, toes up. Okay, let's do 10 and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that is ankle rocking. And then finally, the most important thing that you need to do is to practice your walking. All right, so when you have your hip replacement, it might be awkward for you to walk because everything is tight, okay? So practice your walking, very important. When you walk, make sure that you have your assistive device, especially if you have a lot of pain, all right? But when you walk, make sure that when you first take the step with your leg that had a hip replacement, make sure you are going to point your toes up and then heel touches the floor and then roll your foot until your toes are the only thing that's touching the floor and then toes off. All right, so again, just without the walker so you can see better. All right, so heel touches first and then roll that foot, toes, take a step and then toe off. All right, so practice your walking as normal as possible. Okay, practice it. Go slow first because slow is smooth and smooth is fast. Okay, so using a cane, let me put this aside so it's not on the way. All right, so using a cane, hold the cane to the side where you have the hip replacement. All right, so boom, heel first, okay, cane, then roll that foot, take a step, and then toe off. All right, just like that. All right, let's do it again with the cane. So again, heel, you can also have the cane there. It don't matter, just don't overthink it. Just do the natural movement that your body will tell you, okay? Just make sure it is on the side where you had your hip replacement, okay? Roll that toe, the foot, and then toe off. Do it again, all right? So that gain will help you support your weight and relieve some of that pressure and pain, all right? So most important exercise is your practice of walking. So those are the exercises that you can do to help you get stronger, reduce pain, and get you back to your daily activities. Now, if you find this video helpful, please click on that subscribe button, give it a thumbs up, and hit that notification bell. And if you have comments, suggestions, or questions, just type it down below in the comment section, okay? So again, just remember, consistency is the key and never give up. Until next time, paalam! Shoo!